IV hydration and wellness testing. That's what we're going to talk about in today's episode of In Your Business with Dr. Alex, where we get all up in your business and your health. So I'm going to get into exactly what, excuse me, IV hydration is, what exactly wellness testing is, how the two work together, why you really need to know more about this and actually start incorporating this into your wellness routine if you're really serious about wanting to elevate your overall wellness, how you invest into yourself, into your health, and how you can really elevate that to a whole new level. Because we don't do basic around here, right? We spice it up. So that's why I really wanted to teach more and talk about IV hydration and wellness testing. So if you're hopping on, feel free to say hello. Let me know where in this whole wide world that you're joining us from. And if you have questions, drop them into the chat. I'll do my best to kind of answer them as I go, or at the end, I'll go back and answer. If there's any that are kind of too complicated, I'll reach out to you personally and address those questions. So don't be shy, don't be scared. Go ahead and ask away. So I'm actually going to start with wellness testing first, because wellness testing is going to lead really nicely into IV hydration. So wellness testing, it's not your run-of-the-mill lab work that you get when you go to your regular healthcare provider. It's not like a complete blood count, a CBC. It's not like a BMP, a basic metabolic profile. It's not like what's your iron. It's not any of that stuff. Wellness testing is more looking very specifically, more detailed into your blood, because your blood tells a story. Your blood work is going to tell us a story. It's going to tell us all those little things. It's going to give us all the little reasons why you have these outward things happening, these signs and symptoms and all these other things. And it also alerts us to things that might be brewing and coming about that we're not really picking up on outward on you, that we can see. You might not be really feeling yet, right? Like type 2 diabetes. Many people don't realize that their insulin levels are, or that their blood sugar and their A1C is rising until we look at the blood work. We really don't know about inflammation until we start really looking at the blood work, and then we kind of see those things happening. So the blood always tells a story. So that's where I like to start, because so many women come to me, or I get questions all the time of, I've got this going on with me. I feel like this. And they've gone to a regular provider, right? Because I practice functional medicine. So I look at things very differently. I approach things very differently. I get to the root cause when things are happening. And so a lot of times these women come to me with all kinds of complaints, and they've talked to their doctor. They've had regular lab work done, and they just say, oh, they said all my labs are normal and then I'm fine. Come back in 6 months. And they're like, but the women still feel like shit. They still feel like crap. They know something is wrong with them, but they're being told everything is fine. They're getting dismissed, right? If you've ever felt dismissed by a healthcare provider, let us know, because that is so unacceptable, so unacceptable. So we run some different types of testing, and we can get very specific. There are hundreds of different types of wellness tests out there. And the ones that I really like to run are micronutrient testing, where we look at the vitamins, minerals, electrolytes in your blood. We can also look at different hormonal levels. So when I run blood work on my clients, I run a full specialized panel that I've created. So we look at micronutrients, we look at hormone levels, insulin, glucose. We're looking at growth hormone. I'm looking at all the sex hormones. I run it all when I do my lab work on my clients. And then I interpret that lab work very differently than your regular provider will, because again, they're going by high, low, normal, abnormal. And the only way that they're able to go by those ranges, those data ranges, is because they base that off of the US population. That's how they get these highs, lows, what's normal, what's not normal. And if you stop and think about it, is the US population overall very healthy? No, they are not. So your lab results are being compared to people who are very unhealthy anyway. So your normal or your low normal, right? They're like, oh, you're kind of right there. No, that's low. And that's low for a very unhealthy person. So that's not a good sign for you. That's not a good place to be. So we want to look and get your labs to a level that's optimal. So looking at levels that are in the optimal range. And often they do this with pregnant women. With pregnant women, they look to make sure that all your labs are in an optimal range. Why they don't do this shit and look at your labs like this over your entire lifespan, I don't know. But we do it when women are pregnant. We want to shoot for optimal ranges, right? You're getting prenatal vitamins with mega doses of different things because we're supporting you, supporting the baby. We want to make sure that you're at an optimal level to support that baby being created and growing inside of you. But then we just like stop. We don't think about ourselves after that happens when we could be supporting ourselves in an optimal way for our entire lifespan. So that's a mindset shift I want you to make around that, is really supporting yourself in an optimal way throughout your lifespan. So that's one thing when it comes to the lab work and the wellness testing. And if you have any type of GI issues, there's specialized GI tests that you can look at. There's stool, there's saliva, there's breath. We can take DNA samples, cheek swabs. I have so many actually at my disposal that I'm able to offer. And if you have any questions about a certain type of test maybe that you're looking for, then please feel free to reach out to me. I have a wellness shop that has all kinds of tests that even if you're not a client of mine, you can go on and find a specific test that you're looking for and get answers to symptoms that you're having, to questions that you have about your body. You absolutely deserve to know that, deserve to have the resources to get that information. So that's a little bit about wellness testing. And again, it's not just your basic lab work that you get when you go to the doctor. It's very specific, very specialized, looks at all different areas of your health and can give you answers to symptoms and problems and how you've been feeling. It can really help to pinpoint that. And again, getting to the root cause of issues that you may be having. And then that way you can work with a provider to really create a specialized plan just for you, because everybody's different. Everybody is different. Again, your blood tells a story. It tells your story. So treat yourself accordingly. If you're going to invest in this wellness testing to really get really specific, then take the time to work with somebody that's going to give you a very specific, tailored plan for you based on your test results, which kind of leads really nicely into IV hydration. And what is IV hydration? Well, IV hydration, sometimes you might hear people talk about an IV drip. So it's intravenous hydration. It's just like when you get sick and go to the hospital, right? They start an IV. So it's an intravenous, goes into your vein, and it delivers vitamins, minerals, and electrolytes directly into your bloodstream. And it's available instantly in your body. That is the way that it is so much better available to your body than oral supplements, right? Pills, liquids. When you get these delivered intravenously, they are available to you just like that. And you get the full effect of it versus when you're taking, again, pills and you're taking powders and liquids. This works so much better for you, because there's no digestion needed. And I always tell people this because not enough people know this fact, that when it comes to medications, pills, when it comes to supplements, anything that you have to swallow and digest, if you are missing any piece or part of your digestive system or have had any type of surgery, disruption to your GI system, your body is never going to be able to fully digest, metabolize, absorb, distribute anything that you're taking. Anything. This is a simple fact. It cannot. So if you're missing a gallbladder, a pancreas, you've had diverticulosis, and now you've had surgery on your intestines. I have a lot of clients like that. A lot of women reach out to me like that, or have colostomy bags and all of this. And nobody's ever stopped to tell them this. Like if you're watching this and you have diverticulosis, you have a history of that, you've had a colostomy, you've had any type of part of your intestine removed, put back together, anastomosis, you've had them put back together, if you've had a colostomy bag and then had it reversed, anything like that, please pay close attention, reach out to me, send this video to that person. That way they can learn this too, because not enough people hear this and know this, and it's so vitally important. And this is so great why IV hydration is great for this, why you need the wellness testing to see where your levels of your vitamins, minerals, and electrolytes are, because everybody is different. And when anything is off, your calcium, your magnesium, your iron, your vitamin this, your vitamin that, if any of those are off, your glutathione levels, looking at your antioxidants and your free radicals, oh my God, if any of these are off, then it impacts other functions of your body. And that's what leads to all these other symptoms that people have that they just can't quite figure out. Well, your blood tells a story. It goes back to the blood. How can we fix those levels in your blood to give you optimal results? We do that through IV hydration, because what we'll do is, or at least what I do, is I take the results of that micronutrient testing and I look to see where you're missing, where are you low, where are you high, where can we improve on? And then we formulate specific IV hydration to address those gaps, to address those needs. And again, the IV hydration is available immediately into your system, no digestion needed. So it is just the preferred, most optimal, direct way to have immediate results in what you're doing. It is such an amazing way to support your wellness. And you want to make this a part of your wellness routine. You absolutely do. Just like women, and I'm gonna try not to go into my tangent about the middle class mindset when it comes to self-care and how women are, because when it comes to our wellness and specifically health regimens and what we're doing, working this into your routine, just like you work your hair and your nails and your massage, your acupuncture, your facials, all those things, just like you do that, you want to incorporate your wellness testing, your IV hydration routine, just right along with that. Just make it something that you're budgeting for. Another topic that I like to talk about, budgeting for your wellness. You want to budget that into what you're doing so that it can be a part of your routine. That way you're on it and setting yourself up for success. And oh my gosh, this is such a great thing to work into your routine. And you will see such great results because this acts on a cellular level. It absolutely does, because the vitamins, minerals, the electrolytes, they're going directly into you, into your bloodstream, into your cells. You will immediately start to taste it. This is what I tell clients when they come in. You'll immediately start to taste it in your mouth. Not that you're eating anything. It's when you start getting this IV, because your bloodstream, your blood flow is carrying it throughout your body immediately. So you're going to start to taste it. And some people say some of the different infusions taste like fruits. Some people say it tastes like a vitamin, like a chewable vitamin. I had one guy try to tell me it tasted like vegetables. I totally did not believe him when he said vegetables, but you'll start to taste it immediately. It's in your bloodstream, no digestion needed. You're going to feel it immediately. And that is how it is so superior to anything else that you can do. And so many of these supplements and pills and powders and potions are marketed as 100% bioavailable and 100% this. And it's like, no, it's not, because of you have to digest it. And everybody's digestive system is different. And again, if you're missing any pieces, parts, if you have any type of surgery or trauma to that area, even if you have acid reflux, even if you have some dysbiosis, right? So dys is like a dysfunction. Biosis is like the symbiosis, right? It's things living in harmony. Things are not living in harmony when it comes to your gut and the bacteria in your gut. And so many people have the bloating, have the cramps, have the diarrhea, have all of these weird digestion issues. And it's because of that gut bacteria and how it's growing and how it's living in there. And then what you're feeding I could go on a whole nother thing about this. It's like what you're feeding that bacteria in there place, it's so important to your overall health and wellness. But if you've got acid reflux, you've got anything up with your stomach, any type of surgeries, if you've had bariatric surgery, this is like top, should be top of mind for you and should be being taught to patients who have undergone bariatric surgery, because you absolutely need wellness testing. You already know that you're getting specialized lab work. You have to take specialized supplements because of that. So you absolutely need to have that wellness testing done and the IV hydration on top of that to replenish all the vitamins, all the minerals, all the electrolytes that your body needs. Very quickly goes into your system, lasts for about 2 weeks or so. It's absolutely incredible. And you feel it immediately. You feel it immediately. And there's so many different types of infusions that you can get. They're not just for sick people. So that's the other myth that I'm going to bust right now is IV hydration therapy is not just for quote unquote sick people. If you're listening to this, quote unquote sick people, it's not just for that. Yes, when you get sick and you go to the hospital, they start an IV and they give you fluids. Yeah, because that shit works. It keeps you alive. Absolutely, it works. So that's another myth right there. People be like, "Oh, is IV hydration real? Does it work?" Well, yes, girl, it works, because when you go to the hospital, what do? We start an IV on you and give you fluids because it works. It saves your life in a lot of cases. We're bolusing people, giving large amounts of fluid to people because they need it to stay alive. So it absolutely does work because you need these types of fluids sometimes. But if you're incorporating it as a part of your wellness routine and your regimen, then these fluids with vitamins and minerals and electrolytes that are specially mixed and prepared for you based on your lab work is just the ultimate next level of what you can do to support your wellness. Absolutely. So I'm trying to think if there's anything else that I wanted to say about IV hydration or wellness testing. If you're watching, feel free to drop some questions. Like I said, I'll go back and answer them if I don't see any while I'm on live right now. But you better believe I'll go back and answer you or send you a voice memo or whatever you might need in order to address that. But yeah, it's pretty amazing, IV hydration and wellness testing. Now, does insurance pay for wellness testing? Usually not. That's the other question that I get a lot. Usually, insurance is not going to pay for any type of micronutrient testing or any type of specialized blood work that you want to get, because what has to happen? The doctor has to submit it to the insurance, and then the insurance will approve or deny it, right? They're out here trying to decide what's best for you. I don't do that, because in my practice, I don't go through insurance. I don't take insurance. I don't need no third party trying to tell me what's best for my patient. I absolutely don't. So I don't mess around with insurance. So for me, it's if I think it's necessary for you, then I order it and you get it. There's no playing around. There's no send me this, send me proof of this, send me that, back and forth. I'm going to fax you tomorrow, blah, blah, blah. Call this 1-800 number. We don't do that. We do not do that over here. Whatever you need, I get you. I don't fool around with none of that insurance stuff. So no, I do not take insurance. And that is exactly why, because we've all been through the back and forth, the denials, the approvals, the faxing, all the things. No, nobody has time for that shit. So we don't do that over here. So is insurance going to pay for that? More than likely not. Now, I always tell everybody to at least ask about it. At least ask your healthcare provider and see what they can do, how close they can get you. If you do want to try to go through your healthcare provider and you do want to try to go through insurance, then just tell them. That's why I make these videos, to talk about this stuff, so that way you can at least have the information to make your case if you're going to your healthcare provider. So ask them about wellness testing, ask them about micronutrient testing, ask them about hormonal testing, and kind of see what they tell you. Some will make the effort for you, right? Some providers are amazing. They will make the effort for you. Other ones are going to be like, I don't know what you're talking about. No, I don't do that. Like, they don't even try. So that's one thing that you can do. When it comes to IV hydration, no, insurance does not, will not cover anything. But There are a lot of places that will accept a flex spending account, a health savings account, so an FSA card or an HSA card. If you're in the military, they also have a very similar card that covers healthcare expenses like copays and vitamins and some other things. So you can use that. There's a lot of places that will accept that. I accept FSA, HSA in my practice. So that's always an option too for people when they want to work with me. We can run it through there, and they've set aside those healthcare dollars for that. So that's another thing that you can look into. But yeah, IV hydration, as amazing as it is and wonderful as it is, like we can do so much with like cancer therapy, with vitamin C drips, and helping with chemo hangovers, and people with chronic pain and Lyme disease. And I mean, there's so much benefit out there from IV hydration, targeted therapies, micronutrient testing. Like there's so many benefits out there. And unfortunately, because IV hydration keeps you well, keeps you from having to go to the hospital, can help you to get off of your medications, like because it can be part of a plan that will help you to achieve those goals. They're not going to pay for it. Insurance is just not going to pay for it, unfortunately. Insurance really only seeks to keep you in the cycle, to keep you taking the next pill, to keep you a patient for life, a customer for life. That's really what, unfortunately, insurance is set up for. And the traditional medical model is set up to keep you sick, maintain your illness, not really to set you free at all, unfortunately. Health insurance is great for catastrophic stuff, right? Like major surgeries, traumas, car accidents, emergencies. Yes, we absolutely need health insurance. But for the everyday lifestyle-based chronic illnesses, the shit that's killing people every day, it's not set up to help people get better, get off of medications, to reverse their chronic diseases. It's not set up like that at all. So that's really where you need to take your health into your own hands, learn about IV hydration, learn about wellness testing, learn about biohacking, learning about ways to really optimize your wellness naturally, to really just take your health into your own hands. That's so much of what I teach about. Take your health into your own hands. Be sovereign over your wellness, over your health. Absolutely. So when you're able, unfortunately, that's what you got to do. That's what you got to do, because unfortunately, traditional health insurance is not set up for that. Healthcare insurance is not set up for that. So investing into yourself, into your wellness, budgeting for your wellness, overcoming that middle-class mindset when it comes to your self-care, to your health. That's all the things I talk about on my shows, on my posts, everything. So much of what I'm about. And so I think this will really serve you well to learn more about the wellness testing and the IV hydration. Make that a part of your health, your wellness, your routine, your regimen, what you're living, doing, breathing, what you're modeling for your children, for other family members, for other people in your community. Because you can really stop the cycle of generational illnesses. You absolutely can, in your family, in your community. You can be such a great example of that. You can do that. You can defy the odds. You can break the cycle. That can be you. That kind of hit me right there. Yes. So learning more about these topics that I teach about, take your health into your own hands. And if you have any questions, like I said, feel free to reach out. Let me know. I'll be happy to answer them for you or make more content around them. But IV hydration, wellness testing, learn more about it. Reach out to me if you have questions. If you want to check out my lab wellness shop, let me know. Again, I've got some curated, specialized testing in there that's available for anybody. You don't have to be a client of mine. So you can go on there. I can send you the link and you can go ahead and pick and choose and decide what you want. Take those results and take them to your healthcare provider with whoever you're working with and be like, bam, look at this. Take your health into your own hands. Be empowered. You absolutely can do it. You can save your life. You can change your life, change your family's life, break those generational cycles. All right, guys, that's all I have today. And like I always say, for a balanced life, just add spice. I'll see you in the next